Hello and welcome to our webinar, The Reality of Paper Forms for Your Sports Association. Today we're going to discuss the challenges surrounding all those player medical forms that many of you have to distribute to and collect from families, and manage them within your association before, during, and after an emergency. The safety of your players is your top priority, and a big part of that is the health and medical information you have to hand so you can support them when they need it the most. My name is Michelle, and I'm the Marketing Manager here at ePACT. I'll be your host and presenter as we explore the challenges of paper forms and how to overcome them with a system like ePACT. Before we get started, you might be asking yourself, what is ePACT and what does it do? In case you're not familiar with us, ePACT is an online emergency network that helps sports associations move information usually collected on paper medical forms, waivers, and consents into a secure cloud-based system. This helps them meet legislative requirements around the collection and management of personal health information and provides authorized users with secure access to critical information when it's needed the most. For today's topic, let's keep the following learning outcomes in mind. Number one, we're going to uncover the reality of the paper form process for your sports association. Number two, you'll understand 4 key challenges of managing paper forms. And 3, you'll learn how online systems like ePACT support safety for youth sports associations. Medical information and emergency contacts are key elements when responding to emergencies. Many organizations such as rec departments, sports organizations, businesses, and schools have recognized the importance of this information and require participants, players, employees, and students to submit these details to ensure their safety. Despite many of our lives being easily accessible and implemented online using the internet, most organizations still use paper forms to collect critical participant data, which is completed by hand and then kept in a binder or filing cabinet until it's needed, or a program or season comes to an end. What most people don't realize is that this common practice for organizations can be extremely time-consuming for families having to fill out yet another paper form, and for team administrators who have to manually collect, follow up on, and manage multiple paper forms per player in time for the start of the season. A paper process also often puts organizations at risk because of the insecurity of those forms and because they're easily outdated too. If one of your association's goals is to reduce administrative costs and increase efficiencies, here are a few things to consider. Did you know that 15% of all paper forms are lost after submission? Did you know that it can take up to 5 minutes to access key information in an emergency? And did you know that in a 4-month period, 30% of paper forms fall out of date? With those facts in mind, let's dive into the reality of the paper form process for your sports association. Managing the paper form process is expensive. Organizations can support hundreds or thousands of members at a time, and families fill out paper emergency forms for many organizations too. I mentioned the research that we had done in the past, and the results we received were key in highlighting both the financial and time cost of collecting and managing critical information on paper forms. Some of the key findings include that it takes 20 or more minutes per form to photocopy, distribute, collect, file, and follow up. 30% of forms are returned incomplete by families or are illegible. And based on the amount of time it takes to manage the paper form process, the average dollar cost of managing paper forms per player is about $5. Most organizations handle between 4 and 10 pieces of paper per child per year. This is a huge amount of paper, as is the follow-up required to collect and manage them. So let's assume that your association has 4 pieces of paper per player. You have 15 players per team and 5 age brackets for your teams. You're potentially spending $1,500 per season to manage the paper form process. If your association is bigger and had 10 teams, for example, you'd spend $3,000 a season, and that is a lot of money for any team. There's limited access to information when it's needed the most. Thinking about your current process, where do you store your players' emergency contact and medical information? Perhaps it's filed in binders, stored in filing cabinets, or perhaps it's in a central database that can only be accessed by a team manager or medical staff member. However you store the information you collect, ask yourself how easy it is for these people to quickly access information in a crisis, like a medical emergency or an evacuation. If forms are carried around in binders or file folders for use on the bench or at an away game, are they at risk of being damaged, lost, or even stolen? If an athlete requires immediate medical attention, a coach, risk manager, or team medic has to search for their medical information in a stack of paper forms, which can hold up emergency services and delay necessary medical care. As I mentioned earlier, it can take up to 5 minutes to access key information in an emergency, and that's vital time when you need to attend to injured, ill, or impacted players. While copies of paper forms are added to binders or folders for portability, most forms are often stored in filing cabinets in an administrative office, in the back room, or in a common area for staff or a team. In a widespread emergency, such as a fire or flood, these forms might not be accessible, with the added risk of damage to the forms themselves. The priority in an emergency is to get everyone out of the building safely and quickly without having to worry about going back to retrieve thousands of emergency forms in the building. Health and emergency contact information can quickly fall out of date. With so many forms to fill out, it often means that many forms are incomplete or simply not submitted at all. And when submission rates are low, staff don't have the information they need to support athletes in an emergency. They might not know who's authorized to pick up a player if a parent or guardian is unavailable, and they might not have a way to contact family members if they need to. Contact details and medical information are always changing. Cell phone numbers change, people are diagnosed with new medical conditions, and new prescriptions are added to a medication plan. Yet people submit their information once and forget about it, and paper form updates often require another form and/or an additional manual process. And as I mentioned before, in a 4-month period, 30% of forms fall out of date. If you're trying to manage paper forms, this can become an extremely cumbersome process for team staff and parents too. The quality of the information you collect is lower. Paper forms require handwritten responses, which can pose a major problem with incomplete information. It's common for parents or guardians to improperly fill out information on a form, from writing answers in the wrong field to leaving blank fields where critical information is required. In addition, it's easy to miss the small details, such as a digit in a phone number, for example. All of us have been accused of messy handwriting at some point, especially when we're in a hurry, and the case is no different for emergency forms. Not being able to read a parent's handwriting can be detrimental if the information they wrote down is essential data. It's no help to anyone if the information can't be read, especially in an emergency. So how does an online system like ePACT support safety for youth sports associations? Risk management plays a huge part in many organizations, especially sports associations, and there are several ways that ePACT supports those efforts. ePACT eliminates paper forms. ePACT collects the same information normally collected on a paper form in a single online record for each player. This single record makes it easy to collect, manage, and update information as necessary so that staff always have the most up-to-date information, which is crucial in an emergency. There's no worry about hard-to-read handwriting, missing or incorrect information, so staff can focus on their athletes and the game itself. ePACT's single record also ensures that information is securely stored online, information that cannot be accessed without authorization. This protects sensitive health information and the privacy of the families it belongs to, which creates peace of mind for everyone. ePACT provides authorized access only. Paper forms aren't secure, and that's because it's extremely difficult to control access to personal health information. When forms are stored in a binder or a folder and left on the bench during practice or a game, how do coaching staff prevent anyone from seeing player information? What happens if the binder gets misplaced or it's stolen? With ePACT, associations have complete control over who has authorization to view player information, so staff can only have access to the player records for those in their team or group and will not be able to see information for every player in the association. ePACT helps you stay informed about sports-related injuries. With a concussion module created in partnership with SportMed BC, ePACT helps ensure managers and coaches are aware of an athlete's specific concussion history, guides coaching staff to adjust training and play for affected athletes, and shares accurate health information with medical professionals. ePACT also provides improved security. It uses the highest level of encryption to protect player information, meeting and often exceeding that required by online banks, and it requires families to log into their ePACT account with a unique user ID and password. This makes sure that sensitive health information is always protected and is much more secure online than on paper forms. And ePACT has a mobile app. Instead of having to carry around binders or file folders full of player medical forms, waivers, and consents, ePACT's admin app gives authorized team staff quick access to player medical records in the event of an emergency. Staff can view key information to support a player with an injury, allergic reaction, or if they're involved in a widespread disaster, and can do so even without a cellular or internet connection. That's perfect for those indoor arenas with spotty signal. While it's hard to be able to plan specifically for every type of emergency, having a plan in place and access to critical information can give you a great head start and ensure that at the very least you can ensure the safety of your athletes whether they're at practice or playing a game. And that goes a long way to ensuring parents' peace of mind too. For families, using an online resource like ePACT not only saves them time, but also allows them to be better connected and protected than ever before. Having their medical information accessible online is an incredibly easy way to prepare for life's emergencies and can be done on ePACT in just a few minutes. And whenever they need to make a change to their information, they simply log into their account and do so within seconds to have the most up-to-date information possible while knowing the update is shared with friends, relatives, and organizations they're connected to. For organizations like a sports association, having to constantly remind families to complete their paper emergency forms is a time-consuming task. Often these reminders can take months to get back, and having to go through files and read through everyone's handwriting is even more daunting. You can easily cut back significant hours of time and paper costs by moving this collection of information online. A process that often takes months from start to finish can be overseen in a matter of hours with ePACT. Plus, in having access to these forms online, information is more up-to-date, legible, and easily accessible via the internet or mobile, so you can quickly pull up critical information when it's needed the most. I hope you found our webinar and topic useful and that you have a few ideas to share with your team so that you can work together to plan for those unexpected emergencies and to avoid the use of all of those paper forms. If you have any questions or you would like to learn more about how ePACT can support your sports association, you can visit our website at www.epactnetwork.com, or you can reach out to our sales team by phone or email at your convenience. Thanks for listening, and we'll see you again soon.